Morning, everyone, and welcome to our webinar today. My name is Ben Stapleton, and I'm the Executive Director for the U.S. Green Building Council Los Angeles. We're really excited to host some of our partners from the International Well Building Institute to discuss healthy building strategies to support in the fight against COVID-19. Obviously, this is an issue that we're all dealing with on, if not a daily, sometimes hourly basis, and things continue to evolve and change. And so this is something that definitely in our community, everyone's curious to see what we can do to continue to make progress, continue to support our clients, our partners, ourselves in this fight going forward. And so we want to make sure that we're continuing to bring the latest information to everyone, and our partners at IWBI are a great partner to do that. Just a little bit of background on us, just to remind folks before we kick things off. Our mission here is really to accelerate sustainability in the built environment for Southern California. And to really make this a more sustainable region for all. I can think of fewer days like today that remind us of the importance of this as we deal with wildfire smoke, and we deal with heat waves, and even the call today and looking at how do we make our spaces more healthy. Really is just a great reminder that the work we do really helps create a more resilient, sustainable society, and that we need to harden our resolve and continue to be focused on that. And we really hope to be the organization to really help lead that for the region here. I do want to say thank you again to our friends at IWBI. We look forward to continuing to grow our relationship and do more work together. Everything we've experienced over the past few months is just highlighted how important it is. And so just appreciate you taking the time today. And then want to highlight a few of our initiatives here that we're continuing to grow into the fall. We launched a talent portal on our website in March, where we have really an industry hub for green job postings, training, recorded content. We feature local employers, and we have a mentorship network. Really encourage you to check it out. We want to continue to grow this as a regional hub to grow our talent for the region, and we really think that our talent here in LA can really lead the world as a green workforce. And to that end, we have a number of upcoming webinars, education and training. Just next week, we have some great training on embodied carbon, related to Buy Clean California and the act that was passed here in the last couple of years. Our True Zero Waste and Circular Economy series has the second part, which is on zero waste purchasing here the week after. In October, we get down to really looking at appliance efficiency standards. We have an Envision training that we're doing in partnership with ISI. We're doing some lead training on materials, and then we'll have the third part of our circular economy training series on zero waste reporting. We're also going to try to have a little bit of fun as well. I looked at our upcoming schedule and I was like, this is too much business and learning here. We need to do some virtual happy hours or some tours or something. So we're going to make sure we're bringing some fun, because I think we all need to have a little bit of fun in our life as well. And then we are launching our Green Schools initiative this month. We have created some educational content that's localized to help teach elementary, middle, and high school students about sustainability. We're going to have actually volunteers like yourselves come out and do distance learning for 90 minutes for these schools and talk a little bit about your own career as a great way to connect with youth and let them know that they can have careers doing this kind of work and really help educate people on sustainability. And right now, a lot of our partners in schools are looking for content to help bring into the classroom. Also want to highlight that our Net Zero Accelerator is in full swing right now. I encourage you to go to our website to check out what these companies do. This is our second year of the program. We had over 160 applicants to the program this year, and took 17 companies that we feel like can really make an impact on zero carbon, zero energy, zero water, zero waste. We even have some that are really focused on occupant health this year. So encourage you to check out those companies on our website. And then, as always, try joining our committees if you really want to get involved, whether it's building decarb, green schools, or advocacy. Our legacy project this year is a really inspirational project. Our Women in Green Committee has an upcoming breakfast series at the end of this month. We have a lot of ways for you to get involved in your community. And then lastly, before I turn things over to our partners here, we launched our Healthy Building Alliance in June. We really haven't started really pushing this quite yet. We're going to do this through the fall. And really, we want to provide a gateway for building health and provide a framework for anyone to engage in the healthy building conversation that can lead folks to getting well certified or fit well certified or others. But we tried to pick 5 principles here that we could build some data around that would be low-hanging fruit for folks to engage in. And so this is not a certification, but this is a commitment that any building owner can make to provide healthy space, or any tenant can provide to have healthy space, which is a commitment to indoor air quality, either monitoring or testing, having a green cleaning plan in place, providing access to nature, inspiring movement, and doing some sort of annual water testing. We help provide you with resources and support on the journey, but we really want to help people really engage in providing healthy space, especially during this time today. So with that, I'm going to turn things over to Angela and Dominic, and I just want to say thank you again for your time today, and look forward to the webinar.
Thank you. I'm just going to share my screen. All right, just one moment here. One second. All right, can everybody see this? The right slide?
Yep.
Yes, perfect. Okay. Dominic, do you want to start off with us?
Yes, absolutely. All right, thank you both. So just a little bit of a level set for those who are not as familiar with our organization. The International Well Building Institute is a public benefit corporation whose mission is to improve human health and well-being through the buildings and spaces where we spend 90% of our time inside. So we are thrilled and honored to be part of the Healthy Building Alliance in Los Angeles, and are just excited to be part of this growing community and to be in a position to provide resources, especially as a lot of building owners, as occupiers respond to the challenges and concerns related to COVID-19. We've been advancing this mission since 2014 through the Well Building Standard and also the Well Accredited Professional Credential, and a community that makes all of this work possible. And if you just advance the slide a little bit, we can go. Sure. So jumping into introductions. Again, I'm Dominic, a senior policy consultant for the Well Building Institute. I support a lot of advocacy and policy work under a gentleman named Jason Harkey. So advocacy is a new area for us as an organization, and we'll get into that a little bit later. And then also, of course, co-presenting with me is dear colleague, Dr. Angela Loader, who leads research initiatives and who led a lot of our work on the COVID-19 task force. And I'm probably speaking out of order a little bit, just not seeing the slides, but the COVID-19 task force was comprised of over 600 individuals, ranging from virologists and epidemiologists to academics to medical institutions and building owners and engineers, all figuring out how best to deploy solutions that can address the imminent threats of COVID-19. And I think in a moment where everybody is concerned and confused, in a moment of uncertainty, one thing that has been clear is that healthy buildings and the indoor environments are a key part of the solution. So very pleased to be having the conversation with you all, and hope to provide some worthwhile tips and strategies that you can take forward. So jumping into the agenda, so we're going to go, how we're going to do this is just, we're going to go through the key strategies of the Well Building Standard that can support in the fight against COVID-19. And then in between each section, we'll have a moment for questions and answers. And we'll go ahead and advance the slide there. Would you like to touch on any of this,
Sure.
Angela?
Yeah, so, I think we're learning more and more about what this disease is, how it affects people. I'm not going to get into the details here. We can go into the details a little bit further on. But we know that while it seems to potentially impact everybody, certain populations seem to be more vulnerable than others. The elderly and those with comorbidities such as heart and lung disease. And most importantly, especially where you are with massive forest fires, we had forest fires here in Denver as well. We know that given the pace of recent global outbreaks of disease, some researchers say we can expect more pandemics in years to come, particularly given increased animal and human interaction from habitat loss and changing weather patterns from climate change. So even if we, a lot of the work we're talking about, the task force had been around COVID-19 and other infectious respiratory diseases, the kinds of precautions that you might start for your building around infectious disease is not just for COVID, right? Ideally it's for COVID, but hopefully that would also prepare you for other emergencies and pandemics. And this is from our global community. So we're on the verge of pulling our Well V2 pilot out of pilot, and then COVID hit in the US, and we put the stopper on it. We said, hold on a second, let's figure out what we, maybe we should look at the well building standard, maybe we should stop and take a look at this. And we've got a really big community worldwide. You can see a bit of, how many projects we have, how many million square feet. This might even be a higher number. We have a lot of registered well APs in 93 countries, and our, well community, it's well faculty, IWBI members, project teams, advisors, and they keep coming to us and asking us questions about COVID-19. And Dominic, did you want to talk a little bit about the well as a tool for public health?
Yeah, absolutely. And just on that end about the task force, I believe, these 600 individuals that served on the task force, which was co-chaired by the former Surgeon General, by Joseph Allen, Dr. Joseph Allen from Harvard, represented 30 different countries. And on the slide before, Angela showed that the well building movement represents through projects over 60 countries. So we were able to really address a global community and global resources and figuring out universal ways to respond to the current challenges. So again, just shows the power of this as a public health tool, and that as building owners, as architects, as designers, we have a profound impact, especially during this pandemic, to shape better health outcomes. So well is certainly seen to us as a tool for public health and for cities, for all stakeholders of all kinds to advance this work in partnership.
All right, so from our community, as we've indicated, we had a lot of questions. They started off in China, they kept coming from Europe as the virus moved towards us, and then came to the United States. So, will office air quality be safe when I return to work? How can we manage high-rise air quality? What happens to water quality if the building's left empty? How will IEQ and building hygiene monitoring shift in a post-coronavirus outbreak world? So the strategies you're going to see today were an outcome of those kinds of questions that we had from the community. And this is part of our Places Matter campaign, which is really showing not only that location matters, so we know that latitude and climate can influence vulnerability to COVID-19, but also that your location within the same latitude, right? We know that we spend most of our time in buildings, and quarantine and working from home is really highlighting how well our spaces are working or not working for our daily lives. And lessons learned from healthcare from previous influenza outbreaks, such as the importance of airborne infection isolation rooms, point to the importance of buildings in disease, mitigating disease transmission. And this has been a huge topic. I'm sure all of you have been hearing about it in the news. And one of our frequent speakers, Dr. Joe Allen, has been really pushing this as well, saying if managed poorly, buildings can spread disease. But if we get it right, then we can list our schools, offices, and homes in this fight. In other words, we've known for a long time that buildings and the built environment influence our health. Now, have we been as successful with chronic disease in getting, reducing sprawl? I would say it doesn't seem as urgent. So despite our best attempts, probably not quite as successful as, say, initial outbreaks of cholera and other pandemics that really led to serious public health changes and legislation and policy and codes, the giant sanitation movement in public health. But we're now seeing a convergence of those two things. So we're seeing a convergence of chronic disease, which of course is helped by reducing sprawl and increased physical activity and better eating, as well as infectious disease, which means that the time is ripe right now to really view the building as a tool for public health, to be able to recognize what it can do to increase your risk to infectious disease and chronic disease, and what it can do to help mitigate that risk. So the task force on COVID-19, as Dominic has mentioned, they had two main goals. So to inform new guidelines for prevention and preparedness, resilience, and just recovery. And I'll go over what those mean in just a few minutes. And that actually is on its way. So we're in the final stages of revising that document. We expect it to be coming out at the end of this month, most likely, as well as to inform enhancements to the well building standards. So as I mentioned, we stopped the presses. to look at how well the well building standard stood up really to the recommendations from the task force. And it stood up pretty well. We've had some beta features and some additions. We came up with a health safety rating, which Dominic can go into later on, as responses to the mandates of the task force. But this is what we've come up with, and the strategies are a key part of this document. These are some examples of some of the task force chairs. We were really lucky to get some really big names and experts from all over the world on this. And this helped lead to our strategies from the well building standard to support in the fight against COVID-19. And we're going to be going over those strategies. This is available also as a PDF on our website, and you can put that link in the chat. And these strategies are going to be enhanced and are expanded and form the core of the guidelines that will be coming out. And the guidelines will also have sector-specific responses. So policy, higher ed, designers, real estate, investors, all of them are going to have specific chapters responding to these strategies in the fight against COVID-19. So let's look at some of the strategies here. So we've identified and grouped selected strategies from Well V2 around key themes in relation to COVID-19. This process was started by our China team, and then we took this and expanded it greatly and have adapted it and modified it as the research has shifted. So you've got promote clean contact, improve air quality, manage risk and create organizational resilience. Again, note, this is going to be useful for any kind of emergency, like, I don't know, forest fires. Support movement and comfort, including work from home, strengthen immune systems, maintain water quality, foster mental resilience, and champion community resilience and recovery. So we're going to go through these in buckets of 2. You'll see that they're bucketed already in 2. And we're going to have a chance for questions between each of those buckets. So these 4 segments, we have a chance for questions. So please put those into the chat, and we'll do our best to answer all your questions, kind of live Q&A here to keep it interactive. So when we say prevention, preparedness, resilience, and recovery, what do we mean by that, right? I mean, so some of you working in city work or at different policy levels, or even the building scale, these might have different words. In the context of dealing with something like a pandemic, prevention really means reducing the possibility of infection. And we know key components of prevention include hand washing, isolation of those who are sick, cleaning protocols, and ventilation strategies. And this includes design, operation, and policy strategies that include cleaner air, cleaning protocols, individual behavior change, and immune support. And importantly, prevention includes a risk management approach balanced with a health promotion approach. And you'll see that when we go through the strategy. So it's not just hand washing and better ventilation, but it's also trying to make sure your immune system is strengthened. And this reflects really the approach from the well building standard as a whole, which is balances risk prevention and health promotion. So most of our concepts have a balance of risk management features and health promotion features. So preparedness, and this is really reducing the impacts of pandemics. We know that preparedness is a key differentiator to reduce the spread of infectious disease. Those who've had experience with recent pandemics, I'm thinking mainly of some Southeast Asian countries, like Singapore has done really well, Taiwan's done really well, and had the infrastructure and policies in place, have been able to respond quicker and have had much lower death rates. They've been far more effective because of their experience and the preparedness in that infrastructure. And this also aligns well with organizational level preparedness. Resiliency. Now, for those of you in sustainability, I'm assuming almost all of you, you'll be familiar with this term. So it's a key framework used by industry, policymakers, and academics that increases the chance of weathering uncertainty and change. And really the goal here is to lower the impact of pandemics and shorten the recovery time. Resiliency, as you know, can be at multiple scales. So psychologists talk about individual resiliency. There's building level or organizational level resiliency, which is mainly what we're going to be focusing on today. Community level resiliency, and of course, city and regional level resiliency. Some of you may be familiar with the 100 Resilient Cities initiative by the that just came out recently, and a lot of this has had to deal with, what does resiliency look like in the face of climate change? And we know that resiliency can improve recovery. And recovery, really, again, this is at different scales, right? So this is individual recovery, organizational recovery, building and community level recovery. And these are actions taken to support individual, organizational, community capacity to recover quickly and adapt to the new normal. Unfortunately, I don't think that we're probably going to go back to the way things were. It's most likely some long-term changes for all of us. The best recovery plans are scalable, adaptable, and flexible, preparation plans that can help speed and support recovery. And key strategies include supporting mental and physical well-being and providing opportunities to connect with and support with organizational recovery and community level recovery. And lessons learned, of course, this never should be linear, should be used to evaluate and revise prevention and preparation plans for the next emergency. So let's go through then some of these strategies. Promote clean contact. So we know the main goal here is to reduce exposure. We know that COVID-19 is spread by respiratory particles from an infected person. Now, these particles can be in droplets, which tend to be bigger and fall faster, or in aerosols, which are smaller and travel longer distances. We know that the virus can remain airborne for up to 3 hours and on some surfaces for up to 72 hours. This is currently not thought to be the main vehicle or the dominant mode of transmission. So the CDC has updated their website, and there's been some interesting research recently that said we really shouldn't be focusing on hyper sanitizing absolutely everything, because of the amount of chances you'd have to have that somebody sneezes on it, then you pick it up, and then you immediately touch your nose is a lot. However, as with all viruses or bacteria or kind of influenza type things, it's always good to maintain good cleaning protocols and hand washing habits that can support individual and organizational resilience. I read a research recently that said humans touch their face up to 200 and something times a minute. So wearing a mask and hand washing, very good practice. And key importance here is that soap and water have been found to be more effective than hand sanitizer in community settings, mostly because not enough hand sanitizer is used. And the coronavirus, though it can be deadly, can be broken down fairly easily by soap and water. So the well features that are applicable here is hand washing, so that's feature W8, and cleaning products and protocol. Now, of course, if you are in a zone or an environment in which people touch their face or put things in their mouths, I'm thinking of daycares, of course, you'd want to maintain a higher level of cleaning protocol. The second component of this is improving air quality. I'm sure you've heard a lot about air quality and ventilation recently. We know in general that air stagnation can concentrate airborne viruses or deaths, and we know that increased ventilation in a building can reduce the chance of influenza. Without proper maintenance and filtration, heating, ventilation, and air conditioning systems can build up mold and particulates that can propagate respiratory diseases. We've got some great stats on this. And we've actually seen that improving the ventilation over at least minimum ventilation or even slightly above minimum ventilation is the equivalent of getting 40 to 60% of your population vaccinated against for influenza. So really effective. We've got some great data that's come out recently about natural ventilation, increasing ventilation, avoiding recirculated air. There's some interesting work as well around the humidity. So the jury is still out exactly what level it is, but the research to date seems to indicate that maintaining a relative humidity between 40 and 60% may help to limit the spread and survival of COVID-19. Partially for affecting the way the virus transmits, but partially also if there's more humidity in the air, it tends to attach to bigger, larger droplets and fall quicker. So we know that, when we live in a drier climate, you're also more susceptible to viral infections because of dry nasal passages. So improving air quality, these are the goals here is to reduce indoor air quality issues by providing adequate ventilation and filtration and managing humidity and controlled sources of indoor moisture. So you've got microbe and mold control, air filtration, operable windows, enhanced ventilation and ventilation effectiveness, as well as moisture management and humidity control. And important to note here is that, our guidelines are talking about the goal here is to reduce or eliminate recirculated air, to disable or modify demand-controlled ventilation, to increase level of outdoor air intake, maybe not in California at this exact moment, given the air quality, and to really increase that level of ventilation to reduce the viral load and particles. So we have a chance here to ask some questions. Any questions for us on these topics?
Yeah, so there's one coming in from Amber, which is related to a point you raised a moment ago about hand sanitizer. And so the question is, having hand sanitizer readily available considered a good way to combat COVID-19, and that their company is discussing whether they should have a hand sanitizer in every conference room, and if what they should be encouraging around hand sanitization.
It's a great question. Hand sanitizer can be really useful. It has to be at least 60% alcohol, and it really needs to cover your entire hand. Hand sanitizer for the most part, is meant to be used when soap and water aren't available. Now, if you're going in and out of commonly used rooms, like a conference room, placing a hand sanitizer there is probably a good idea before you touch anything that other people might have touched. But in general, the most effective way is washing your hands regularly and frequently and not touching your face. And in fact, if you've got a lot of people in a small space, and you're not sure about, and the ventilation, the air circulation rate isn't high, I would recommend masks as well. And that's mostly because, you know, the chance of you getting something that as I said, somebody's touched and then immediately touched your, you know, that you get it, it's there, of course. We know that that's how some viral things spread, like influenza and the common cold, but it also means you're touching your face. So if you're wearing a mask, then you're also reducing the chance of touching your face. So yes, good to put in there, but really emphasize hand washing with liquid soap, not the foam soap. Liquid soap has a higher concentration of soap in it.
Great, and we have, looks like another question related to sanitizing. So what are the best ways to, and so I guess this one's related to air circulation actually, and what are the best ways to increase air circulation within a house? I think I'll jump in quickly. I think the simplest thing that we've heard is simply opening up the windows. It is the most simple and cost-effective thing you can do, and it's something that often goes overlooked, but it's easy. It depends, of course, on what city you're in and what the outdoor air quality is like. But if you're in a place like Colorado or you know, maybe not LA on it every day, but that's one of the things that we've discussed. And Angela, I don't know if you have anything to add to that.
Right. So for any space, the first idea is to open the window. Again, barring massive forest fires or very poor air quality. If you can't do that, then increase your outdoor air intake with filters. So MERV 13 at a minimum, and HEPA filters. Increasing certainly your airflow circulation. And if you absolutely can't, if you have to use recirculated air, not likely for a house or an apartment, but if you have to use recirculated air, absolutely use, you know, a filter. And then as a last resort, let's say you're in a stuffy room, you've got other people that have been in that room, the air circulation is great, there's no windows, then an air purifier can be used that's appropriately sized for that space. But the air purifier works best and it's an enclosed space and it can really do that turnover. So again, that's the kind of the lowest, that would be the final step. The first step would be to open the windows.
Thank you. And then one last thing before we jump to the next section is another question from Amber around humidity. And so it's actually to the contrary, Amber. So the humidity, so the sweet spot, which has been referenced a lot, is 40 to 60%. So the survivability of a virus like COVID-19 is higher from what we've seen in the research with lower humidity. So in very dry environments is when this virus thrives the most. And so that's why the recommendation is a little bit higher. I don't know, is there any other points to make on humidity?
Yeah, so the humidity, if it's too humid, then you risk bacterial infection, right? You mold and other things, which can aggravate your respiratory tract, and you don't want an aggravated respiratory tract. That's why people with asthma and other issues are more susceptible when there's air quality issues or any kind of infectious respiratory disease. But 40 to 60% is good. Of interesting note, a lot of buildings are quite dry, actually, when they've got, you know, HVAC systems, and there's been a lot of complaints about dry buildings. This is something to potentially raise with your facilities and management. There's been some studies that were pretty interesting on daycares and preschools, which we all know are germ festivals. And they increased the humidity by just a little bit, and it reduced both the viral load in the air and on surfaces, as well as the rate of infection. Now, preschoolers and daycare isn't necessarily representative of the entire population, but they do tend to get sick really often. So that was and there's still some debate on exactly what level of stability is needed, but generally speaking, a little more humidity is better. Again, because the virus particles almost always attached to something, right? Dust particles or respiratory droplets or something like that. And if there's more moisture in the air, it's heavier and is likely to fall faster. meaning that it's less likely to be transmitted over longer distances. Okay,
Great.
wonderful. Well, let's move on so we have a chance to talk about the other strategies. So our third strategy is managing risk and creating organizational resilience, a very hot topic right now. So emergency preparedness planning is a risk management approach that enables a rapid response. I think a lot of organizations are being caught a little bit saying we weren't quite prepared for something like COVID-19, countries as well. And organizations, as we mentioned earlier, should regularly reevaluate their emergency preparedness plans, and knowing that adaptability and flexibility are essential components to this. Something we do want to mention for organizational preparedness, there's a couple different scales where this can happen. It can happen at your individual scale. It can also happen at organizational scale, and of course at your community scale. But something that's come up a lot and a key consideration is support for working parents. Because of global school closures, and we've seen a lot of schools started to open up, but some of them are still closed. My own children are still not in school. Many professionals are full-time caregivers at home and are struggling to balance responsibilities. So this is a great example of something that's not likely to be predicted when you're doing your emergency preparedness planning, but is something is good to have, is good to know about having plans in place that could help your populations. So as we've known, the pandemic is highlighting already existing stressors in our society, especially in the US, right? It's not like working parents are already having an easy time. It can be challenging for them to balance work-life responsibility. You know, we know that flexibility can help with retention, and it helps with that work-life balance. So something like COVID-19, where suddenly all the childcare is taken away, can really exacerbate already existing tensions. So an organization that was going to have a higher level of resiliency would already have flexible plans in place, would be able to work from home, would be able to have flexible schedules, or even like a fund that they could use for childcare. Something like that will help to buffer already existing tensions. And every organization is different, but that's just one example of something that COVID-19 has highlighted. And a really good way to know what your organizational sort of stress points are is being informed by evidence. So regularly capturing occupant feedback can help to inform emergency protocols and address topics like work performance, satisfaction, and well-being before, during, and after a period of remote work. So we have some of our, at the Well Building Institute, all of our projects have to do a post-occupancy survey. And if we're really lucky, they do a pre-occupancy one as well. We have a whole bunch of pre-approved survey providers, and some of those survey providers have benchmark data before COVID-19, during COVID-19 with remote work, and then as people are starting to return to work. So they're getting some really, really interesting data on what these trends are, that, you know, what is important in working at the office and what is working and maybe not working at home. What is the mental health like? What's the level of physical activity like? That kind of data is invaluable because it means you can target your managing risk plans and your emergency protocols for your particular population. And surveying employees, we know, can help evaluate the effectiveness of the strategies that were deployed, identify current mental health challenges, which is a big topic right now, and inform new strategies. And I'm happy to answer any questions about surveying since I run that program. So there's strategies in WELL that support this. It's emergency preparedness and family support under our community concept, as well as the occupant survey and enhanced occupant survey, also under the community concept. So the fourth strategy is supporting movement, comfort, and including working from home. We've seen that you know, a lot of people suddenly have this giant work from home experiment. And that, you know, the photo here is clearly somebody's trying to stand. I currently am on you might see me wiggling a little bit. I'm a balance board and I'm standing. But that's because I work remote full time. A lot of people are balanced at the kitchen table. They don't have a place to work. This is some of the data that's actually come from one of our survey providers, that if they have a dedicated home office, working from home is not that bad. If they don't have a dedicated office, working from home is definitely not great. And as we know, especially in some of the coastal cities, nobody moves to San Francisco or to New York because they want to work from home, right? Very small living spaces. So we know that data is scarce. There's some indications that up to 44% of companies did not allow remote work. So there wasn't a remote work policy in place. And they may not be prepared to provide guidance to their teams on how to create a functional and comfortable home workspace and a work from home experience. We know that ergonomics is the study of how the work environment meets the user's needs, and understanding how to provide remote work ergonomics and support for physical activity and movement throughout the day is key. And again, this is going to have to be support from at home, support maybe as part of the workforce returns to work. How do you provide both of those, that support to get that movement throughout the day? Now, WELL doesn't address directly work from home strategies per se, but many of these strategies can be meaningfully adapted for home-based work. So some of the features that support this are from movement, so visual and physical ergonomics, active furnishings, enhanced ergonomics, and self-monitoring, i.e. wearables. And in fact, some of the data we've seen that work from home, there's an increase in musculoskeletal issues because people aren't necessarily working ergonomically. We know that they're working really long hours. So again, time for questions. Would love to hear your questions on this.
Let's see, one just came in. Has there been any discussion around preventing repetitive injuries in a work from home situation when the typical solutions such as sit-stand desks, split keyboards, footrest might not be possible, or even having articulating monitor arms? What do you think about that?
It's a really good question. In fact, some organizations are letting employees use part of their annual stipend for workplace wellness or other things, or office supplies. They're shifting that money from the office to work from home to let people have, for example, I don't think a sit-stand desk, but some like an ergonomic keyboard or some other things. Some of the strategies, absolutely. One of the biggest thing is even the best position is not good over an extended period of time. And so the idea in movement science right now is less like get to the gym every day for an hour, which is great if you can do it, but we know, maybe going to the gym is not the best idea right now. People don't always have the time. What we want is constant movement throughout the day. So you want to shift position regularly. A lot of organizations, in fact, our own organization has had, they scheduled on the calendar like movement break, 10-minute movement break, where you can join in and do some, we did a Bollywood dance thing for 10 minutes. It was hilarious. But you got your heart rate up for 10 minutes. And most of us can find 10 minutes in a day, right? Other things that can be done, certainly you saw that example, raising the laptop off of the desk. So if you're on a laptop, there's no way you can have good posture. You're automatically kind of hunched over. And you're going to get repetitive wrist injuries, neck and back issues. As we know, musculoskeletal issues are the #1 reason for physical illness that people miss work in the US. One of the biggest things is an external keyboard, because then you can raise your laptop. So my laptop here, I'm working off my laptop and I've got an external monitor here. But a keyboard, and preferably an ergonomic keyboard, is one of the fastest and easiest ways to be able to get a better work from home environment, as well as being able to shift. So, if your company has the money or organization has the money to be able to provide sit-stand desks, particularly if we're going to see maybe part of the workforce working from home for longer periods of time, maybe only got 50% or 30% capacity back at the office for, it could be another year, then that's something to consider, weighing the risks and benefits of giving people some small funding to be able to make their ergonomic home situation better, versus the cost potentially of missed work because of musculoskeletal issues.
Yeah, it's such an important question, especially as you, Angela, pointed out that most people don't have a home office, I would say, and they don't have the necessary equipment. And I know Switzerland, because somebody asked about mandates related to another subject, but in some countries, they're also exploring if this does become a big part of reality in terms of how we work. There are some mandates that are now in the works of mandating that employers provide a stipend, like Angela mentioned, to cover some of these home office costs. Switzerland and the highest court had just passed that back in August. So I definitely think that there'll be more movements like that in the future. I don't see any other questions on this topic, so we can go ahead and move along.
Okay, great. And if you have a burning question about this topic afterwards, please feel free to answer that as well. We're hoping to have some time for questions at the end. So strengthening the immune systems. Now, we all know we're supposed to eat healthy and exercise, right? But what we may not know is that chronic disease and the state of your immune system is directly linked to your susceptibility and the chance of dying from COVID-19. So we give the example here of discouraging smoking. We all know smoking is bad, but did you know that those who smoke or have chronic obstructive pulmonary disease, or COPD, which a lot of funding is towards at the state level in public health, they're at an increased risk for developing COVID-19. And smoking is associated with multiple negative health outcomes, such as reduced life expectancy, respiratory infections, coronary heart disease, and cancer, all of which increase your chance of both getting sick from and dying from COVID-19. Harvard came out with a study in the spring. I think it was an 8% chance higher from air pollution and chronic disease for dying from COVID-19. Healthy sleep habits. We're understanding more and more that poor quality sleep, thanks toddler, or not enough sleep has been associated with a range of negative health outcomes, including impaired immune function. In fact, there's a whole bunch of swath of books out that not getting 8 hours a day of sleep actually impairs your brain's ability to clean itself out, and is being linked to Alzheimer's and other diseases of the brain, neurological diseases later on in life. Poor decision making, lack of immunity, strong immunity, and we know things like exposure to daylight and circadian lighting lighting design has been shown to have a positive impact on sleep quality. So again, understanding, yes, of course, we all know we need sleep, but there are some things, even if you don't get a great night's sleep, that you can do to help get better quality of sleep and improve your circadian lighting, which is a big advancement in the last, I would say, since in the last 6-7 years, really integrating not just lighting for task function, which has been traditional, saying, glare, do you have an adequate task lighting? Do you have an adequate overhead lighting? But really, how does that quality of lighting, that color of the lighting, the color and timing of the lighting, the amount of lighting impact your circadian rhythm, and how does that impact your health? The features that are talking about that support your immune system, of course, offering physical and mental health benefits. So mental health support, again, and in this particular time period, online support as well. And this is an update in the TrueV2 coming out. Health services and benefits. We know that prevention is the best cure, right? Creating a culture of health. We didn't used to have a wellness officer, in fact, and when we got well certified for our New York office, we have a wellness officer now. And I have noticed a huge difference in just the culture of health that somebody's part of their job description is, are you moving today? Have you taken time to meditate? Here's some recipes. She would come in and cook sometimes in the office. It really makes a giant difference between what your policy is and what your actual practice is, and whether it's okay to engage in that practice, as I'm sure many of you know. I'm discouraging smoking, of course, staying nourished and hydrated, enabling physical activity throughout the day, and promote healthy sleep habits. I will say that there's some interesting data on obesity as having a higher risk of dying from COVID-19, as well as dehydration. So dehydration is linked to obesity, which has been linked to a higher risk for COVID-19. So it's not just the usual, eat right, exercise. We've known that for a long, long time, that those specific things directly impact your susceptibility to infectious respiratory diseases like COVID-19. And I think we're only starting to begin to understand why some people get super, super sick and why other people don't. And it seems to be centered around the immune system. So really interesting upcoming area of research. So maintaining water quality, of course, is super important. We know that exposure to a range of contaminants in water can result in negative health impacts, including the spread of infectious disease. This is not necessarily always an issue, and that's maybe live in Flint, Michigan, in the US and in developed countries, but WELL is a global standard. And so we don't, some of the countries we work in don't necessarily have water quality they can count on. So it's really, really important to test the water. It's important to test the water here anyways, because there might be fluctuations in the water quality that you might be able to catch before maybe there's a mandate or an announcement that comes out. Be careful of the water. Water is typically treated with chlorine to keep it free of pathogens. But if left stagnant after a period of vacancy, which we're seeing happening at higher ed institutions right now, chlorine is likely to lose its disinfection power, creating the opportunity for pathogens to contaminate the water, as well as things like Legionnaire's disease and Legionella. I think we just had our first case in the US recently. So features that support water quality is, making sure you've got fundamental good water quality, making sure there's not contaminants in the water, enhanced water quality. If the water quality tastes great and it's healthier, people are more likely to drink it, and water quality consistency. So making sure, again, that you're testing the water quality on a regular basis to take into account that there might be variations in municipal water supply. All right, so we've got some chance to ask questions on immune systems and water quality.
Yeah, so some things might be coming on, but on the topic of, you mentioned, I'm at the beginning, immunity, and there was a recent study that came out that actually, it's anecdotal, but it shows that a flu vaccine's efficacy is lower in people that had less sleep. So they had like a number of subjects, I forget how many, like that, a significant amount. And they showed that the efficacy was 50% lower in people that had not gotten an adequate amount of sleep. And so as we are thinking about a COVID-19 vaccine, and hopefully in the near future, sleep, may have a role to play in that, but also in just every aspect of our lives. Let's see.
Sleep is also, it's an interesting point, because to use a previous example, for many parents who, there's a large percentage of the US population that are working parents, that they are having, if they don't have any childcare, they're having to work very, very long hours, right? So they have to maybe work part-time during the day, look after their children, and then they catch up at night. And that's really exhausting. They may not be sleeping. It's not the best idea to stare at your screen at midnight before going to bed. So that's an interesting convergence, where if you haven't taken into account safeguarding resilience for your staff and your population, that can then impact their health quality. And if we expect that people are going to come out of this and go back to work, let's say we had a vaccine tomorrow, and then people can go back to work. People are exhausted, right? They're exhausted from working at home. They're exhausted from these long hours. The chance of their immunity being high going back is probably not very high. So it's another example of needing to take into account physical and mental health, as well as emergency preparedness policies.
Yeah, definitely find that as the lines are blurred between home and work, that many people are at higher risk of burnout, which is a whole issue in itself. And on one thing that I've found that can kind of lead to burnout is also eye strain, and how that can create stresses. And so there's a question about our tendency to constantly be checking our phones and using our laptops around the clock. And if there are things that we can recommend to help with screen brightness. One thing that, Angela, you'll have some tips here, but one thing that I personally have been using is a privacy screen. And so the privacy screen helps reduce some of the blue light. And then I also have blue blocker lenses, which I think the jury is still out on whether or how effective those are, but I found that it's actually reduced my eye strain. And part of that could be placebo, I don't know, but it seems to be working. Do you have any other tips, Angela?
For eye strain, natural light.
Reducing screen brightness specifically, yep. and the negative impacts of that.
Yes, so trying to avoid, there's a study I think out of Harvard that showed that exposure to blue light, the kind we get from our laptops and screens and computers, in the evening delayed the production of melatonin by up to 4 hours, which is quite frightening, because you want melatonin to be able to sleep well. So I also have blue light blocking glasses in the evening. You can put screens on your covers on your laptops. You can put your phone into night mode. But really, ideally, if you have the option, let's not be checking email at 10 or 11 o'clock at night. It's not very good for one's sleep or mental health.
Easier said than done, of course, but it's always good to make an honest effort. There's so many questions. Have goals.
It's good to have life goals.
Yeah, good to have goals. So we can go ahead and advance. There's so many great questions, and I'll try to see if we can save some of them and we can follow up with them. Okay. But just being aware of time, we'll go ahead and move ahead.
Perfect. So we've got 2 more strategies here. And the 7th one is fostering mental resilience. Mental health has been in the news a lot recently. And the goal here is to maintain mental health. So of course, if somebody's got mental health issues, and of course they're much more prevalent than we, I think, like to acknowledge in our society, then this has to be, of course, mitigating those and monitoring that, but also trying to maintain good mental health. And mental health here, though it does have stigma, is really a state of well-being in which individuals are able to live to their fullest potential, cope with the normal stresses of life, work productively, and contribute to their community. And chronic stress is one impact that negatively affects your mental health and your physical health, has been associated not only with emotional and mental health issues, but increased risk of depression, cardiovascular disease, diabetes, and upper respiratory infection. And I'm really glad you brought up burnout, because I see a lot in our survey work that everybody wants to know how productive are people. If we put a well building in, are people going to be more productive? And it's a really good question. We have to ask really serious questions about performance, about engagement. Some people have talked about energy levels, but the flip side of performance is burnout. And the WHO, the World Health Organization, made and recognized that burnout as a work condition, as a health condition to burnout. There's a lot of great research on burnout. We're working on some work on that acknowledges burnout with our global research agenda, which I can discuss later. But it's really important, particularly when people are working long hours, whether or not they're doing caregiving or not. We know that the data to date is that people are not taking holidays as much, that they tend to be putting in even longer hours than before, and that really can lead to burnout. And burnout can be pretty serious, and it's not very effective both for your physical health or as an organization. There are some surveys that can be done to kind of look at your risk for burnout, and one of them is on our enhanced survey option. But it's a really, really important issue, particularly now we're seeing that these issues with depression and isolation and loneliness, as well as burnout. So some of the strategies that we talk about in the Well-Building Standard to sort of mitigate or help support positive mental health, strong mental health, are ways that you can help buffer that. And one of those things is nature and daylight, access to nature and daylight. And then access to nature is one of my own areas of expertise. That we know that a connection with nature through plants, water, light, and views, or an indirect connection through natural materials, patterns, colors, or images, also called biophilic design, have been found to improve mood, recovery from stress, and concentration. And I'm happy to answer endless questions on this topic. I had a book out recently on it. So we also know that breaks from work are linked to employee well-being, higher life satisfaction and mood, sustained workplace performance, and lower burnout and fewer health complaints. So at the workplace, the Well-Building Standard talks about providing space to kind of shut off from work for a few minutes, take a nap, meditate, lactation rooms, things like that. At home, you would have to build those things in or encourage those things in for people to take breaks at home. And a lot of that comes from the top down and from company culture and organizational culture. So the strategies and features that are linked to maintaining mental health promotion and education, really important, especially around stigma, stress support, and a lot of that is understanding what kind of work your people are doing, and then do they have the level of support required to be able to complete those tasks and on time, restorative opportunities and restorative programming. Again, unless your people are going back to the office regularly, or if they're going part-time back to the office, how can you encourage taking a walk, maybe walking meetings? How can you encourage or providing opportunities for them to take short breaks from work to be able to come back refreshed and restored? Access to nature and daylight. Features that support this are access to nature and enhanced access to nature, and light exposure and education, as well as enhanced daylight access. So you notice I've put my desk right next to the window, and it's an uncharacteristically cloudy day in Colorado here, but that daylight really helps my circadian rhythm and stress and mental health, as well as taking a walk, viewing trees, going by a lake, any access to nature. We know there's 30 years of research on this that can really improve your stress and mental health and your mood. And the last feature that we have here is championing community resilience and recovery. And I think this is a really important point that often organizations don't necessarily see the link between their organization and the community. But this is becoming really important as businesses are shutting down and we're wondering what kind of community we're going to be left to go back to. And when people are working from home, they're starting to look even closer at what their neighborhood is like. What is essential to make that neighborhood viable and vibrant and supportive. So we know that providing space for community engagement and connection has been linked to positive mental and physical health outcomes. Now this gets a little more complicated with COVID-19, that people don't necessarily want to share their space, but in general, organizations are starting to put some of their space as public space, or share their space, or invite more connections with that community. And we know that individuals with community and social support generally have better mental health than those without strong community connections. And even we've seen this from working from home versus at the office. There's some indication that the sense of community from those face-to-face interactions is one of the key builders of trust and a sense of community and organizational culture, which is one of the things that's emerging of why you might still need a physical workplace. An important thing to note here is that pandemics can disrupt supply chains and worsen food insecurity globally, or as in the case of the US, national coin shortage. But local food networks can provide some kind of security during the disruption of national or global supply chains by supporting small and medium-sized farms. We also know that eating with local suppliers can also result in social benefits. There's a lot of research on community gardening, farmers markets, and healthier eating habits. So again, these are very concrete ways that can encourage people that have been shown evidence-based ways to get people to eat healthier food, to connect with one another through food, and that the Well-Building Standard supports through some kind of, through different features, such as civic engagement. So encouraging people to have civic engagement, even get a paid day off or volunteer time, and community access and engagement. We know this has multiple benefits physically and socially and emotionally, as well as providing access to localized food sources. So food production, some organizations have provided community gardens or food production space, which is huge stress relief, as well as supporting a local food environment. And this can be siting. So in a build, if it's a new build, siting somewhere with access to fresh fruit and vegetables and good healthy eating options, or so having, if there's food on site, supporting local community supported agriculture or farmers market to bring that food in, which really gives people connection to their local environment. All right, we've got a few minutes for questions.
All right, so one about colors and patterns, and how you can, or what colors and patterns rather that you can use to promote connection to nature. That's a pretty big one because there's a lot of research there, and I'll direct you to Terrapin Bright Green, who has done a lot of really great research on this topic. But just a quick response would be, so we have seen a lot of companies' use of colors. So blues are pretty known to be very soothing. Also green to mimic grass, and using that in floors, or also just using wood grains. So we've seen a lot of projects implement a lot of things that are representing trees and bark and just anything that can symbolize or reference nature. And that can be in many different forms. Angela, do you have any strategies there?
Yeah, so Terrapin's Bright Green, they've got 14 patterns of biophilic design, originally developed by Stephen Kellert, and that's been expanded upon multiple times. There's some great work out there. We did a presentation with the International Living Futures Institute and biophilic design, so if you're on healthcare or other strategies. The ASID, American Society of Interior Designers, one of our sort of showcase case studies, has some great examples online of carpet patterns, of, again, natural wood grain, like Dominic is mentioning. There's anything that really makes one think about nature, like shiny surfaces make us think of fresh water and clean water. All of those things can be very, very helpful. And I know they've done a lot of great work on that. Again, actual access to nature is always considered best, because we respond really well to plants and respond really well to fresh air and sunlight. But even in combination, oral sounds, like sounds of the water running or birds chirping, are very soothing to most people. So a combination of those strategies can be great. But again, trying to get people outside is a really important to get access to nature. Just fresh air and sunlight can be a huge, huge mood boost.
Excellent. All right, moving on to the next one.
Oh, do you have any other questions? This is the last strategy. We have 8
Oh,
strategies.
right. Right. No, that's it for the questions. There's some good ones, and I'll see if there are any last ones that could be.
Great job fielding those questions too. They just kept on coming. Looks like there's one more about the vitamins question. I guess there was a question around what.
Right. That's a good one. Yeah, good catch. I responded to vitamin D and sun, but I know Angela will have a much more robust response as to which vitamins and nutrients have the largest impact on immune health to combat COVID-19
It's a great
specifically.
question. In fact, the Center for Restorative Health at the University of Arizona with Dr. Esther Sternberg, they have a series, I think it's recorded, in which one of their speakers went in detail about different research and supplements on immunity. But the supplement I would say is the most important for respiratory disease. The evidence to date is vitamin D. They've shown that enough access to vitamin D, and many of us don't get enough because we don't get enough sun, even if you live in a very sunny state. We wear sunscreen, we wear hats, we're indoors most of the time, has been shown to reduce the chance of getting influenza. And this was done on seniors, but there's been other research that shows a lack of vitamin D is being linked to a susceptibility to influenza, and adequate vitamin D has been shown to help with your immunity against influenza. So specifically for infectious respiratory diseases, vitamin D I would say is your number one. But also check out some of those resources. University of Arizona, I think it's the Center for Integrative Health, and they have a webcast series, and they specifically went through this, her research, went through the supplements and the research on it.
And then one parting question, because I know that our time is up, but this actually leads us into one of the things we wanted to mention anyway, which is around emergency preparedness plans focused around business continuity and what considerations should be in that plan. And this is referenced and actually promoted within the Well Health Safety program, which was one of the outcomes of the COVID-19 task force, and it gets very specific about business continuity, about emergency preparedness plans and what those should entail. So I'll put a link out there, and Angela, if you'd like to add anything while I do that, please feel free.
Yes, we will be having more information on that on the guidelines, and it is in the health and safety rating, which is available online. That's got pretty extensive guidance on what are known factors that have been helpful at an organizational level to deal with emergency preparedness. A lot of it has to do with leadership. A lot of it has to do with communicating results or communicating policies or status regularly and updates. And having good chains of command. So some of the things that are being shown to be really effective is knowing where your stress points are. So if suddenly the building shut down tomorrow, who needs to have access to what equipment and what technology and what online servers? Does everybody have the technology available? I mean, for example, we had enough people working remote or had remote work experiments that it wasn't a huge shift for most of us to start working at home. My spouse, nobody worked at home. And so they didn't even have necessarily the laptop or the technology set up to suddenly to have everybody working from home, which of course delays a business when every minute counts. That's been shown to be really important, as well as really chains of command, having very clear chains of command and responsibilities when things go south. Who takes care of what, who's responsible, what are the next steps? Is there a constant evaluation on preparedness? So, you know, are these things outdated? Is the equipment outdated? Do they have points of contact? Do they have a plan A, a plan B, and a plan C? Have they thought about, you know, for example, you know, in California, having plans around earthquakes and forest fires would likely be very good common sense, right? What happens when the air quality is really terrible? What happens if there's an earthquake? Those are pretty known risk factors for California. Drought, other issues, heat waves, having plans around that for organization, as well as business continuity plans. So there's taking care of your people, and then there's taking care of the business to make sure that the business can continue to run. If your supply chains are disrupted, if you can't get into your building, you know, what do you need to have in place? Which really goes against our just-in-time culture. Just-in-time culture is not very effective at dealing with emergencies like this because we just don't have the backups. So a good plan, and insurance companies worldwide will tell you this, a good plan is to have those backups, to have those procedures in place, which in fact, from the evidence we've seen, with, say, the carbon accounting project, really rates an organization higher as being more resilient and a lower risk. An organization that really is just flying by the seat of its pants and doesn't really have plans in place if something goes wrong is rated as a much higher risk, and is not loaned money as often. This is really starting to be seen we've seen that with investing, green investing and health investing, where they're starting to ask questions like, what's your emergency preparedness plan? Are we going to give an organization money that doesn't really have a plan for climate change, doesn't really have a plan for the health and well-being of their occupants, for example, during a pandemic, or one that does and is being shown to be resilient and has those plans in place? We're starting to see that investors are asking, like, tell us what questions to ask. We do have a page on investing for health on our website as well, but what questions do we ask to be able to know whether an organization is taking this seriously? We are coming up with a global research agenda. It's on its final stages of production. We had a research advisory started up last summer with 20 experts from around the world, as well as our own research team. And we've come up with 12 impact topics, narrowed down, that really are needed for health and well-being to move this forward. It identifies gaps and barriers. And one of the biggest things we were discussing yesterday, in fact, on how do we talk about this global research agenda? How do we talk about this, what we need to know, what we need to do around health and buildings, is saying that health, and it's a McKinsey report that just came out with this, saying health needs to be a strategic imperative, a strategic operations and plan, and not facilities or HR component that is supporting strategic imperatives. Health itself needs to be a strategic imperative on its own, because it's so essential to the running of the building, to the running of the organization and its people.
Yeah, to the conversation of ESG and how building owners and companies of all types are prioritizing this. Health, for the first time, we're in a event or a period where health is materializing, and health had always been sort of this area that fell in the social component of ESG, and nobody really knew what the proper metrics were to evaluate companies or to benchmark them. And I feel like there's so much momentum at this moment to figure that out, and that health has a really big opportunity to serve as the benchmark for the S, which has been hard to crack. And I just sent a link on the Investing for Health, which you can find there. You can find webcasts that we've done with everybody in the social impact investing space and the ESG world, if you want to learn more about how to do that. And if you're a building owner, an educator, anybody that is figuring out or trying to figure out how to bring people back safely, I strongly encourage you to consider the health safety rating and to just give it a look. There are a lot of strategies that were covered in here, but even more so in direct response to COVID-19. That's looking at what you should be thinking about in terms of air quality, in terms of water quality, in terms of business continuity, and so on, in terms of HR policies as well. So please give that a look. We have gotten a lot of momentum from the Empire State Building to the Yankee Stadium, which is now trying to welcome spectators back into their building, and saw this as a very powerful tool to communicate their efforts. So we're around if you have any questions that you want to follow up with at a later time. I know that we are 7 minutes over, and we had a few things we wanted to talk about, but we'll have to just do another session sometime, Ben. And one thing to note as well, if you're a teacher in the Los Angeles area and you're grappling with some of these issues, there is a training that for teachers that is being offered for free. Feel free to follow up with Ben or me if you'd like more information on that. We're also working on an effort, hopefully, to also address poll working and also polling centers and how you should be thinking about healthy indoor environments and cleaning protocols, what you should be doing to stay safe to get out the vote. So lots of great things and definitely more to come.
Thank you, Dominic, and thank you, Angela. This has been a great session, and I completely agree that we should look at doing another one, even just what you mentioned around schools and polling places. A lot of us are just struggling with trying to figure this out on a day-to-day basis, and would love to work with you to make sure that the people in our communities and our market here are really educated and informed. So if there's any other links you want us to share, please send those to me.
Will do.
I'm going to try to.
Thank you, Ben.
No, thank
Thanks,
you. I'll
Ben.
try to wind this down here for everyone. Just want to mention again our Healthy Building Alliance, of which we're proud to partner with Well on. Let us know if you're interested in enrolling in this program. Feel free to check out our website or please reach out to us. Also, just want to remind you to please be engaged, become a member, or join a committee, be a mentor. There's a lot of ways that we can work together to really build a more resilient, more sustainable society on a local level. And then if you appreciate this content, I would just ask you to please donate. We try to provide as much as we can for free, but you can donate to us by texting GREEN to 707070. It helps support our small team to continue to deliver content like this with great partners like IWBI. And then as always, I want to say thank you to our annual sponsors. They really help us do the work that we do on a day-to-day basis and make all this possible. So thank you everyone for taking the time today. Please be healthy, be well, and on a day like today, try to make sure you have some clean and fresh air. That's an important thing. So thank you. Enjoy the rest of your day.
Thanks, everybody.
Have a nice day, everyone.
Be healthy.
Bye-bye.